Okay. There we go. All right. Hey, thanks for coming, everyone. We're really excited to have you. Again, welcome to New Patient School. This is a training powered by PatientStream. My name is Sam Carlson, and we're joined today by our buddy, Dr. Andrew Wells, who we'll turn the time over to here in just a minute. If you are new to PatientStream, a couple things before we get started. Number one, on Zoom calls, there is a chat feature and a Q&A feature. I'd ask you just to use the chat. I have the chat up and I'm monitoring it so I can kind of see if you have a question. I can hold that and ask Dr. Wells or answer it myself at an appropriate time. Try not to use the Q&A. It's just ridiculous. So the chat, again, is the very bottom of the Zoom window. Engagement is number one. The more questions you ask, the more you're going to get out of this. All right. And by the way, not just for you, but for the other attendees as well. So any question you have, there's no question that is ridiculous. In fact, there's a way where you can private message me if you're worried about other people seeing it. So you can just private message me. Okay. PatientStream, we have a very simple goal here. Our goal is to help docs grow their practices in the following ways. One, we provide the only software that allows you to run niche-specific marketing campaigns, okay? We provide training on the most effective methods to increase new patient conversions, and we're trying to build a community of docs with the same drive and passion you have, which is to get more new patients. That's what we're here about. And we try and make it between our software and our training and everything we do, we try and make it so easy that even this dumb dodo bird can do it. Okay. At the end of the day, if you're not getting a result or if you're struggling to do something, we don't want it to be because we've made it too difficult. Our software is built to make new patient marketing and lead gen easy for you. Okay. You don't need an agency to run it. And then the training we do just like this. They are recorded. We take notes, which reminds me, I'm hoping, Heather, if you're on, would you message me and let me know that you are taking notes today? But we take notes, which we then upload into our Facebook group. So we can ask you, awesome, she is on. Thank you, Heather. And we can provide those to you as well. So once again, thanks for coming. We're excited to have you. So I want to introduce my good buddy, Dr. Andrew Wells. Andrew is an awesome guy. I met him a couple of years ago. And by the way, if you've been on these trainings before, you've already been introduced to Dr. Wells. We've got new folks that are coming on and they don't know Dr. Wells. And he's got a lot of really cool, interesting insights to bring to the table. So he's the owner of Simplified Integration. And he has the background of running his own practice, several practices, scaling those to 7 figures, has a lot of success and insight into what it takes to take a clinic from, beginning to like a startup to a 7-figure clinic. Okay. So he's got that background. He also hosts, if you've ever heard the Simplified Integrations podcast, it's called Simplified Integration Podcast, right?
That's right.
I added an S. Maybe you need more integrations. I don't know.
Just one integration.
Yeah. So he hosts that podcast, which is great. I had the opportunity to be on that a couple of weeks ago. That was awesome. And most importantly, Dr. Wells and I share this, which husband and father, first and foremost over everything. And he's an awesome coach, and he is a contributor here at PatientStream. So we really appreciate everything that he brings to the table. So with that, Dr. Wells, I'm going to turn the time over to you. Let's just go ahead and maintain my slides, and either I'll intuitively switch or you can just say switch.
Yeah, I'll tell you spacebar or delete.
Wonderful. Wonderful. Sounds good.
All right. Hey, I'm looking at this profile picture. I happen to be wearing the exact same shirt and jeans I was wearing in that photo. So there's a lot of congruency.
Wonderful.
I love it.
That's awesome.
That outfit just works for me. Well, thanks for the introduction. I really appreciate it, Sam, and welcome everybody to the training. Happy Friday, happy week before Thanksgiving. I hope you all are looking forward to next week and spending some time with your family and people you love. And I'm really, this is I think the third time, Sam, I've been on this training, and I really enjoy these trainings that we do. And some of the stuff we're going to talk about today is some tactical information, but especially in this training, a lot of what we're going to discuss, there's a lot of nuance in it. And I hope I can give you some really objective things that you can do to not only increase the profitability of your practice and increase conversions, but also to make sure that your patients are having a great experience in your office and you're building up your office over months and years because you're treating people the right way and you're building a community and people know who you are and start referring to you. And so our goal today really in this first slide is to provide you with 3 strategies that the top 5% of our profession has been using for years. So these are strategies that we use to build multiple 7-figure practices. These are the same with our coaching clients. I've been coaching clients now for the last 5 years. And what I've noticed, these skills that we're about to talk about today, when implemented properly, will help your practice grow. And I've seen this happen over and over again with our clients, really helping to build up their practice and make it bigger, more scalable, and also just, again, offer a better quality experience to your patients. So please take notes. If you have some paper, get out a paper, pen, and if you have any questions throughout this, please let me know. I would love for this to be interactive, and as always, I'll stay on at the end of this training to answer any questions that we have. I do get I'm kind of passionate about this. I like teaching this, so sometimes I tend to ramble or go off in tangents. So if something I'm saying doesn't make sense, please, in the chat box, just say, hey, Dr. Wells, just pause and explain what you're talking about. I'm happy to do that. So what we're going to cover today, number 1, we're going to talk about the patient experience and how this is extremely relevant, especially in 2020 and the years moving forward. Second thing we'll talk about is a concept called pre-framing and how you can use this concept and strategy to help convert more new patients and also to help your day 1 and day 2 conversions go a lot smoother. And then also 3 things that Sam and I really think that you should know and implement in your practice today. And that's going to be some more of the tactical stuff. All right. So first off, question for you guys. What would you say? So if I walked into your practice today, what do you think is the very first thing that 80% of the clinics do wrong? And if you have a second, jump on the chat box and let me know what you think. Like, what is the biggest thing that clinics could improve on, or the things that we get wrong right out of the gate with clinics and handling patients? Does anyone want to be brave and type something in?
Max Thomas says phones.
Okay, totally agree. What else? And I want you to frame this in terms of like, what are we getting wrong in terms of handling patients? Or what is one thing that you can improve on when handling patients? So as you think about that, I want you to think of your clinic specifically. And Sam, if you would click to the next slide for me. Building rapport. Eric, 100%. So yeah, that totally leads into this next slide. So I want to share a little story with you and to give us some context. When you're talking about customer service and making a good first impression, that is a really big deal. And your patients, just like in any human relationship, we're judgmental people. And just like if you're going to meet someone for the first time, or you're at a party, or you're around colleagues, you pretty much know if you like or don't like that person, like in the first 30 seconds, minute, maybe 2 minutes. The same thing is true with patients and their feel for how they like your office, or what the feeling they get from your office. So we have to start thinking of our clinics more like the Ritz-Carlton and not like the Red Roof Inn. And I've seen this, it's funny, man. You can almost gauge a clinic's performance based on this one thing. And you walk into a clinic, and this could be a chiropractic clinic, a dental clinic, primary care office, whatever. How patients feel when they're introduced to your office has a huge, huge impact on whether or not they become a patient and stick around with you long term. And this is also true with how you handle people on the phone. People get really quickly, they get a feel for whether or not they want to come into your office based on how that first interaction on the phone went. So I want to share a story with you. Not too long ago, I took our family to, it was actually the Ritz-Carlton. We don't really usually spend our time in fancy hotels. I'm kind of a thrifty guy, so I'm more like a Hampton Inn type dude. But two things, I've been to the Ritz-Carlton twice. One time we went because we went to a conference. I brought our team and our front desk staff, and we all stayed at the Ritz-Carlton. And the reason I did that was not just to give, to spend a lot of money on a hotel, but I wanted my staff to see what excellent customer service looked like. So before my team and I walked into the Ritz-Carlton, we had a little powwow, and I said, okay, I want you guys to do a couple things. Number one, I want you to remember how you feel when you walk in the hotel. Number two, I want you to sort of take mental notes on the things that they're doing to make the customer service experience good. And then also the third thing I said, I want you guys to figure out, throw them some kind of objection or a question or something that you want them to do for you when you walk in the hotel. So those are the three things I asked them to do. And so this was actually a training exercise. So we went to this hotel just because I wanted my staff I wanted to show them what we want our patients to feel like when they walked in. And sure enough, we went into the Ritz-Carlton. Their customer service was like A+, top notch, and my staff was like, "Wow!" They actually got a couple of really good ideas that we stole from the Ritz-Carlton to implement into our office. And so recently, we did the same thing with our family. We walked in. I have two young kids, as you saw from the picture before, and we walked in, and right away we walked in the hotel lobby. The staff was like, "Okay, here's a couple with two young kids," and so the first thing they did was, "Hey." So they welcomed us and were really polite and really sweet. And they said, "Hey, do you guys want to come see our candy table?" And my kids are like, "What? Candy table?" And my kids probably saw it right when they walked in. But right in the lobby, they had this like huge table full of like every cool candy you can think of. It was like Willy Wonka land right there in their lobby. So all of a sudden my kids beeline it to the candy thing. And the staff was really polite. They said, "Hey, would it be okay if we offered your kids some candy?" And we're like, "Yeah, as long as, don't give them like 5 pieces, give them like 1 or 2, they would love it." And so one of the Ritz-Carlton staff members took our 2 kids to the candy table, and they showed them like, "Okay, we have this and we have this, and what's your favorite candy?" And they were really sweet with our kids. But tactically what they were doing was they were freeing up me to go to the front desk lobby to check in without the distractions of our 2 young kids, but also for the comfort of all their other guests. Like my kids are ones who will run into a hotel lobby and they'll just start running around and throwing stuff. And so the staff was actually distracting my kids from bothering everybody in the hotel, which was brilliant. And they did it with they were so kind about it. And so that allowed my wife and I to get checked in, to make our payment, to figure out what our room was, get our room key and all that. So that whole process, by the way, we didn't wait. So we were helped right away. There was someone waiting at the desk for us. They knew that we stayed at the Ritz-Carlton before, and they actually had some of our preferences from our previous stay in their system. So they knew that we liked our bed sheets not tucked in at the bottom. And so they actually took care of that for us. The temperature that we had our room set at the last time we stayed was in their system. So they knew that we walked up, we wanted it at 71 degrees, and that's how they had it all set up for us. So they showed us to the elevator. We went up. They carried our bags for us. We were in our room for about 5 minutes, and then we heard a knock on the door. My youngest son, who was 4 at the time, runs to the door, opens it up, and they said, "Hello, sir." And my son's like, "Hi." And he said, "Hey, we're just checking in to make sure that everything in your room is the way that you want it." And I said, "Yep, everything's great." And he looked at my son and said, "Excuse me, young man, is there anything that you would like?" And my son looked at him and he goes, "Yeah, I would love some bubble water." And he goes, "Sure thing, I'll bring you up some bubble water. Is there anything else I can get for you?" And his little 4-year-old mind is like, he's just like, "Man, this is a great place." And he's like, "Yeah, do you have cheese crackers?" And the man said, "Well, I don't know if we have cheese crackers, but I think we can probably figure out something for you." And so the guy went away, and he comes back about 4 minutes later with bubble water and goldfish crackers, which weren't cheese crackers, but close enough. And my son was just like over the moon. He's like, "Man, I really like this hotel." And so that whole experience was, and we still laugh about that experience today, like my son ordering room service. But the feeling that we got from that hotel and the way we were treated, it's just like, man, what a fantastic place. and everyone was so nice, and the room was perfect, and we felt really welcome and at home. And so I want you to start thinking about that. If you've never gone to like a high-end hotel, check it out. Take your wife or your girlfriend or significant other or whatever there for a business expense to see what good customer service looks like. And so what you'll start to see are some strategies and patterns that you can implement in your office. And I can guarantee you that the Ritz-Carlton staff trains on these things. So what happens if two rowdy kids come in the lobby? How do you handle that situation? What happens when someone asks you a question? How long should you expect a new patient or a new client to wait in your lobby or your office? All those things need to go into place. So some things that we implemented in our office was, just like the Ritz-Carlton, we're always anticipating the arrival of a new patient. So every morning before we start shift, here's something that you could do tactically. So if you're taking notes, here's something that you can implement today. Every morning before shift, we have a 5 to 10 minute huddle. During that huddle, we talk about the new patients who are coming in that day, when they're coming in, who they're bringing with them, and what their chief complaint is, and also where they're coming from, whether it was a Facebook ad or a screening or a referral. So when the patient walks in, we actually, we have windows in front of our front desk so we can see people walking up to the office. So if it's a face that we don't recognize and it's the time that a new patient should be showing up, it's like, oh, that must be Jane. And when Jane walks in the door, it's, whoever's available at the front desk, even if they're on the phone or talking with their patient, we always either you give them some warm greeting. Like, so for example, if you have a front desk staff who's not currently tied up, we walk around the front desk and say, hey, you must be Jane. I'm so-and-so. It's so great to have you here. Welcome to our office. So you want to make sure that you have good eye contact, that you're friendly, that you're shaking hands. It might be a little bit different now with COVID. Some people don't feel comfortable shaking hands, but welcome that person as if this is like somebody you love's grandmother or a really good friend of yours, or like one of your best patients' referrals. So these people should be greeted with just a lot of enthusiasm and love, and also make it genuine. If it's faked, like don't give them fake smiles and fake handshakes. Make sure that it's authentic and genuine, and really try to make them feel welcome. Some of this stuff you can do, and actually, before I say that, I'm going to jump to the next topic. So let the patient know what to expect. So when they walk in, the first thing you want to do is, if some of you will send new patient paperwork through email and have them filled out beforehand, which is great. If the patient is showing up and they don't have their new patient information filled out, let them know what the next step will be. So for example, if Sam is my new patient, I would say, Sam, welcome to the office. Here is our new patient paperwork. If you wouldn't mind taking a minute to fill this out, it should take you about 10 minutes. In the meantime, if you have a copy of your driver's license insurance card, we'd be happy to make a copy of that for you so we can verify any insurance benefits. And then once you hand them the clipboard, before they start filling it out, little Ritz-Carlton type tips. So if you need the restroom is right over here on the left. Would you like a bottle of water while you're filling out your paperwork? So offer them a bottle of water. Or if they have any kind of like physical needs, like if it's an elderly patient, would you like someone to help you fill out the paperwork? So try to meet their needs, and just be things like offering water or showing them where the bathroom is are little things that you can do that don't take a lot of effort, but it shows that you have a high level of customer service. This concept, this fourth bullet point down, is show, don't tell. One of the things that we noticed at Ritz-Carlton is, instead of them saying the elevator is just around, it's the second hallway on the right, somebody actually walks you to that hallway and says the elevators are, follow me, I'll show you where the elevators are. And they literally walk you to where the elevator bays are. So for instance, if a new patient comes in and says, you know what, I do need to use the restroom first, one thing you can do is say, great, let me show you where the restrooms are, follow me. And you walk them to where the restrooms are, so they're not wandering around your office for the first time feeling uncomfortable. The fifth bullet point down is, are you doing an office tour? And this is where I find you can make a really big impact on patients who are just coming to your office for the first time. Now, let me paint a little picture here. When you walk in our office, like we do a lot of spinal correction. So you'll see patients doing neck traction, and they're on wobble discs, and they're on vibe plates, or they're doing decompression. We have open adjusting bays, so there's a lot of noise. So just imagine if you've never been to a chiropractic office before and people are getting their necks popped and hanging from the wall and wobbling. It's a really odd sight. And so as we're walking a patient from the front desk back to their consultation or back for their day one exam, we're explaining what's going on in that scene, because they're going to be like, all right, what are these people doing? This looks weird. I don't know if I'm in the right place. They have all these questions. So we make it fun. And as we're walking them back to the exam room, we just, we point out what's going on. And this is a time when your front desk staff can start to inform the patient on what your office is good at, or what makes the doctor unique, or what's unique and special about the way you approach health issues. So it's a really, that like 30-second, 1-minute walk back to the appointment room is a great opportunity for you to insert a script or sort of a 30-second commercial on what makes you guys special. And if there are certain things in your office that you have to walk by that may make the patient feel a little bit uncomfortable, like the adjustment bays or any kind of like active or passive rehab you do, just point it out and say, hey, the reason our patients are doing this funny look and wobble exercise is because it helps warm up their spine before an adjustment. It also helps pump fluid in and out of the disc, which warms up your spine and helps keep your spine and your discs healthy for a long time. It's a really simple exercise we have our patients do here in the office and at home to help keep your spine healthy long term. So it's just a really, like, you explain what you're doing, what the benefits are, how it could potentially help that patient, and just gives them some it makes them feel a little bit comfortable. Just like if kind of like, if you have a dinner guest over for the first time, you sort of, I don't know if people do this anymore, but you give them a tour of your house. The exact same thing. It just makes people feel warm and welcome. So if you're not doing an office tour, that's something that you can implement right away. And I would just suggest making a script for it so that it's the same time. It's the same every time you do it. And then go what I call the extra inch. So all these little things are free to do, minus giving someone a free bottle of water that may cost you $1. But go the extra inch, meaning that there are little tiny things you can do to make the patient feel great. So let me give you an example. After a day one or a new patient exam, on my way home, I would always call the patient and say, hey, Sam, it was great to have you in the office today. I just wanted to give you a call and say, I had a chance to review your x-rays and I had a chance to talk to our providers today. We're going to put together some recommendations on how we can help you with your back pain. But I just want to let you know, we really feel that we can help you. Have a great night, and we look forward to seeing you on your next visit. So that is a 30-second call to let the patient know, hey, we really value you being in our office. I looked at your exam and x-rays. I think we can help you. We'll cover your results. We'll cover the results of your exam and x-rays on your next visit, and have a good night. Like, if you look at this, like, when was the last time a doctor called you in the evening just to say, hey, great to meet you. I think we can help you. Yeah. Patients love that little stuff, and like, wow, thank you so much for calling. I was really nervous about coming in. You get a lot of really good feedback. So when they come back on day two, they're going to feel more at home. There's sort of a principle, and I can't remember where I found this, but if you meet somebody or have 3 different interactions with somebody. So this could be one interaction on the phone, one interaction in your office, which would be a third interaction, and then a second one, and then the third interaction would be a second phone call. If they've talked to you 3 times or 3 different interaction experiences, the feeling of getting to know somebody radically goes up. And this might be an awful analogy, but I'm sorry for being crude if this is crude, but it's like, I heard this when dating. And I don't know where I got this, probably some bad high school dating information, but the information I got in my locker room in high school was, you got to wait till the 3rd date to sleep with somebody. So sorry if that's crude, but more normally people aren't going to sleep with you on their first date. However, if it goes to 3 dates, they may feel a little bit more comfortable doing that. And again, sorry if that's a crude example, but my point in saying this is the more contacts and the more connection you have with the patient, the more times they're in front of you, the more they're going to feel like they like you and trust you, or they may feel, you know what, I really don't like this person. They'll get that feeling too within the first 3 visits. So the more sort of really light touches and interactions you can have, the better.
Yeah.
So I hope that makes sense.
Can I add a couple things here real quick before we go on to the next slide?
For sure.
So in the tour, one of the things that I've heard and is a good idea is making part of your tour something to the extent of like a success wall, right? And meaning, locating a place in your office where you have pictures or testimonials, something along those lines. In fact, Dr. Woolner has a wall that has like these really cool graphics where people have quoted, different things, and making it the cases that were severe, right? And then that way, when you have, because most of your cases are not going to be severe, okay? And so when people come in and they think, oh my gosh, they helped that person, well, I'm nowhere near that, right? And so you could say, hey, something to the effect of, this person came in and their, feeling in their feet was reduced and they like couldn't feel anything. We were able to put them through our protocol, and in as little as 2 months, they were, better, or whatever the case may be. So having a success wall that really showcases, some pretty awesome case studies is a good idea. Okay. The next thing, just real quick, and maybe more like a rapid fire. I know there's a lot of things that people could do, and I don't want people to think, oh, these are good ideas, and almost lose the impact of how much leverage this can create. Like, you can compound your new patient conversions by doing these small, trivial, somewhat seemingly trivial things. I wonder if instead we might be able to paint a little bit of contrast, and maybe you could rapid fire some things that clinics do wrong, and almost like the most common things you've seen both in your practice, maybe you were doing before you changed, and things that you've coached other clinics on. Just rapid fire, not dwelling on any, just saying, hey, symptom. What are your thoughts there?
Yeah, great idea, great question. So some things I'm seeing, let's look at on the phone. So some things that people do on the phone is they're not smiling, they're not happy on the phone, and people can tell that over the phone. And so no one wants to go into an office that has unhappy employees, because if the employees aren't happy, then the patients surely aren't going to be happy as well. Also, being and I'll talk about this in a future slide, but future pacing patients on what the next step is, and we'll talk about that in just a minute. So often patients they want to know, okay, what happens next? What's the next step? So we're going to talk about pre-framing in just a minute. That's a huge skill. When patients come in the office, new patients especially, what I'm seeing is that front desk will oftentimes make them wait, or they don't have all the files and the paperwork ready for the patient. So I've seen sometimes patients wait like 15, 20 minutes in an office to go back to have a consultation or an exam. That should never, ever happen. And also just, how many times have you walked into a doctor's office and it's just like you get that sliding glass window in front of you, and they slide the glass open, fill this paperwork out, have a seat, let me know when you're done, and then come back when you're done. And there's no like, hello, how are you? It's great to have you here today. Like this little, like just, sometimes we take the human element out of it, and we look at patients more of having to process them as a task, versus we have this amazing opportunity to help this person with this health issue that they're dealing with. And so if we start to look at patients like this is somebody's mother or grandmother or child, like how would their family want them to be taken care of? And if you're not looking at it through that lens, you're going to miss a lot of opportunity to just love on your patient and give them a good experience. And so some people do this very naturally, and some people don't. And even for both types of personalities that either are natural or not natural, it's something that needs to be trained on. So we would actually train on, okay, every Tuesday morning, or we would do training every Tuesday, Thursday morning. We would have one of our staff members literally open up our front door and walk in, and we would train on how to handle that person. And so if our staff was saying something awkward, or they were dropping the ball in a certain area, we would just call them out on it and say, hey, I think maybe you could do it a little bit differently this way, or try doing it this way. So we would just role play all those different scenarios. And so that's the last thing I want to talk about, is just I see a lot of offices and staff just winging it. And they're expecting, the doctor's expecting that their front desk staff is just going to know how to do this stuff naturally. And that's just a bad expectation. And so we really need to be actively training, actively role playing on customer service. The best companies the companies that do customer service really well, they train on it and they practice on it on a regular basis. So I talked a little bit about pre-framing. So we're going to jump into pre-framing. So we always want to tell our patient at least one step ahead in the process. And one example I use here is that the first time I ever got adjusted, the chiropractor didn't tell me what he was doing. And he just said, lay down. And he started moving my neck around. And all of a sudden it was like, wham, bam, crack. And I'm like, what the heck did this guy just do to my neck? Like, I'm like, oh my gosh, he just broke my neck. Like, this is crazy. I was in my 20s at the time, and I knew that my neck was going to pop, but I didn't know when he was going to do it. I didn't know what to expect afterward. And, you know, I did like the adjustment, but a lot of patients will be turned off by that. So the example I use here, one of them is, you know, if you're going to adjust a patient, especially if they've never been adjusted for the first time, let them know what to expect. So I'll tell them, all right, I'm going to adjust you. You're going to feel, you know, a little pop in your neck or your back. It's going to sound really loud, but you're in good hands. I've done this, you know, 10,000 times. It's super safe. I just want you to stay relaxed. And I'll tell you right before I adjust you, I'll tell you when I'll adjust you so you know what to expect. And it really puts the patient at ease because you're just telling them exactly what's going to happen and what to expect. And there's a lot of comfort in that. If you would skip to the next slide, Sam. So pre-framing is all about managing a patient's expectations. So we want to let them know, here's what you should experience during this step in the process. And I'll give you some examples of that. If you could skip to the next slide. Okay, so question for you guys. If you don't know what this is a knee decompression machine. It's just like doing decompression on the spine, but for your knee joint. And so my question for you guys, for docs, is that if this was a new patient for you and you're putting them on this apparatus for the first time, what would be a good way to pre-frame what they're about to do? And I asked this question because I was just in a doc's office, and this doc is a really high performing doc. He's a great communicator. And I asked him the same question. He goes, okay, when the patient gets up from the chair, like we actually role played it. And I got in the machine, did the therapy, and I got up. And he goes, hey, how does your knee feel? Does it feel good? I'm like, no, it doesn't feel good. It just feels the same as when I got in the chair. He's like, huh. And so I said, is that what you say to all of your patients? And he said, yeah. He's like, well, you know, I want a lot of our patients stand up and they feel really good after knee decompression. And I'm like, well, what happens for the people who feel worse or they feel the same when they stand up? Do you see how that could make them feel like the therapy has just failed? So what we do, let me give you an example, and you can use this example for adjustments. You can use this example for what I'm about to share with you for decompression, spinal or knee decompression. You can do it for weight loss even. So what I would do is I would set this patient in the chair and say, all right, Jane, so what we're going to do here is we're going to gently distract your knee. This is going to open up your joint space to allow blood flow and fluid to move in the joint. I'm going to sort of paraphrase this, but when you stand up, you're going to notice one of three things. Number one, you may stand up and you may feel a little bit sore. That's completely normal because your knee hasn't moved well for the last 3 years, and it looks like you have signs of arthritis. Second thing is you may stand up and you may notice no difference whatsoever. In fact, a lot of our patients get up and like, wow, I don't think that did anything. That's completely expected. This issue has been like this for a long time. We wouldn't expect it to heal, within an 8-minute session. And the last thing, and this is the critical one that I really warn patients about, you may get up from this chair and you may feel like I've just waved a magic wand and removed 3 years of arthritis and degeneration, and you may feel like you may want to go run around the parking lot and do some laps. Don't do that. So if you stand up and you feel like I completely fixed the issue, just know that it's going to provide you some temporary relief. It's going to take some time to actually correct the problem, but I just don't want you to do further damage to your joint just because you feel good after standing up. Does that make sense? Patient's like, yeah. So what I'm doing is here, I'm painting all three scenarios. So if they feel great, awesome. I told them they could expect that. If they don't feel any change, or if they feel a little bit stiff, I've also explained that that's a normal outcome. So whatever the outcome is, whatever happens, they're going to say, oh, well, Dr. Wells told me that's how it's supposed to go. So that's a normal outcome. And so what we're, does that make sense?
That's
and
amazing.
So,
That's amazing.
So here's what you can do that with your first adjustment. Same thing. So you may stand up from this adjustment. You may feel sore and stiff. Well, it's your first time being adjusted. You may feel no different. So one adjustment really is not going to correct this problem. And you may feel amazing. So just telling them what to expect. And so you're really, it's kind of like remember like the dandruff shampoo, like you put it on your head and they say, the commercial, it says, you can feel it tingling. That's how you know it's working. It's like when you put it on, like, oh my gosh, it really is tingling. It must be working. It's the same principle. And so if you're not explaining these things, or if you're painting an unrealistic expectation. So in other words, again, hey, stand up. How does the knee feel? Do some squats. Does it feel better? Nah, not really. You've just ruined that patient. So just paint them a realistic expectation and all the different outcomes that could happen. So if you're doing, like, let's say you're doing weight loss and you're using like a lipo type laser machine, you can say to the patient, like, this is one visit. You may notice tonight that your clothes might fit a little bit better. You may feel like fits the exact same, or the same three scenarios. You can do that with almost any health condition. And so I want you to think about how you can pre-frame every part of your process. You can pre-frame your Facebook phone calls. You can pre-frame your day one visit. You can pre-frame everything in your day two visit. So if you can skip to the next slide, Sam.
Can I add one thing real quick? And maybe maybe I'm butchering your presentation, but no. Would you mind if I just threw one more thing in here?
Yeah, for sure.
So I think that, by the way, is genius. And if you guys didn't write that down, let me know in the chat, because you should be vigorously taking notes on that one thing. What are your thoughts on it? And have you ever implemented this? Where it's like, you should notice, and then it's all of these subjective things, right? And you're pre-framing them that way, because confusion is the enemy to conversions, right? And so if they get up and they don't know what to, like, you didn't give them education on what they could expect, then when they experience something, they don't know, they can't just magically create what it was in their brain, right? So you're giving them that information. Do you ever say, here's what I'm looking for, right? Because you're two different people. There's the objective and the subjective. And when you pre-frame them, you say, here's what to expect. And as you're going through this treatment, here's what I'm looking for to make sure you're a fit for what we're doing. Have you had experience with something like that? Is that something you've done before?
Yeah, absolutely. Yeah. That's kind of sort of a deeper level of pre-framing. And you want to, yeah, absolutely. You want to communicate that. And so let me give you an example of this. When we were just doing regular, like just traditional spinal correction type work, we would take an X-ray of a patient on day one, and then on day two we'd have them come back. We'd adjust the patient. We'd have them, we'd give them some head weights and some spinal corrective type weights. And what we would do is we would take a second X-ray on day two to see if, after the adjustment and after using specific weighting, if the X-rays changed at all. And so I'll tell the patient, look. So what we want to do is measure your results before you came in and after one treatment or one adjustment, and see if anything changed. If it changes, that's great, and that'll give us a lot of information on if we can correct the issue, how long it will take to correct the issue, and what we can expect in terms of overall results. So we're now giving them, like, yeah. So Sam, to answer your question, yes, we're telling them here's exactly what we're looking for in terms of even it can be a measurable result just like that.
It's so funny.
All we're doing, like, patients want to know what you're thinking. Tell them what you're thinking, and hey, I'm expecting you to get better within, to get 80% better, 90% better. Now, I don't always do that, but there are certain instances where the patient wants to know what's in your head. Just tell them what's in your head and be honest. And when you're really transparent and honest with patients and let them know what you're thinking, they will appreciate that.
Yeah. Everybody knows that story of when Babe Ruth raised his bat and said he was going to hit it into the left bleachers, right? And he gets up and he does it. Calling your shot is, now that's a very, interesting example, but this is in a way calling your shot, and it's establishing your position as the expert, which one more note I'll make on this and then I'll let you get on. If your staff, as they bring this new patient to you, they need to position you as the expert. That person's there for neuropathy. Dr. Wells sees X amount of patients every single month and has a passion for helping people with neuropathy and doing it without pharmaceuticals, invasive procedures. He does it all with his, blah, 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 whatever. So even like pre-framing and giving the proper authority position to you can start with your staff. And again, that's training, that's doing those things. But again, you don't want to be a salesperson. You don't want to be like trying to convince somebody. You want to be an expert, and an expert gives advice, and advice is a lot more valuable than a sales pitch. So I'll turn it back over to you because I love the pre-framing concepts, and these are really good tactical approaches to implementing it quickly.
Yeah. Sam and I were joking earlier this week, an example to use on this. If you've ever, one of my favorite movies, Dumb and Dumber, the end of the movie, they go to this ball to meet this girl, and Jim Carrey says to the other actor, he goes, "Hey, go over there and tell her how great I am, so I don't have to brag about myself later." It's a really good example. Like, that's a good thing to do on your office tour. So have your staff, exactly what Sam said, is build you up on whatever your skills are. Maybe your skill is just that you're a fantastic human being. Your staff should say, "You know what, Dr. Wells is just the nicest person you'll ever meet. He's great," if that's true. Or he's one of the greatest spinal correction doctors in like, if you have those kind of attributes, your staff should be sharing that with your patients. Yeah. So let's talk about some times that you can actually, when do you implement pre-framing? Like when do you do it? How do you do it? Where do you do it? Pre-framing happens a lot in our offices especially during the day 1, day 2 process. Now, if you look at the bottom of the slide, pre-framing typically takes place during transitions and conversations. So for example, at the top, this first quote is, when the patient comes up to the front desk for the first time, they just walked in your office, you hand them the paperwork, tell them what the next step is. So once you finish your paperwork, we'll take you back for your consultation. And then once you go into the consultation room, you'll say, "All right, we're going to start with your consultation. It'll be about 5 to 10 minutes. After your consultation, we'll have you meet with our doctor." And so do you see where the transition happens? So the transitions happen, from the front desk to the consultation room to the exam. The third quote down here is, when I'm in an exam with a patient, after your exam, we'll set up a time to review your results with you. Because the patient might be expecting you snap an x-ray and then immediately you're going to cover their x-rays with them right after you take them. And then also, like the last one on your next, so after, when the patient's gone through your entire day 1 process, you're setting up for your day 2 visit or your report of findings. You tell them, this is an abbreviated version, but you tell them, on the next visit, we'll review your x-rays, we'll go over our recommendations for you, we'll talk about your insurance coverage, any out-of-pocket costs, and et cetera. So you're explaining what the next visit looks like. So every step of the way, the patient is saying, "Okay, I know what's about to happen." And then when it happens, they're like, "Yeah, they said that was going to happen." And it's a comforting feeling. So you're just walking them through every step of the process. Now, one of the mistakes I see doctors doing, and clinics and front desk staff doing, is they're giving away all this information all at once. So for example, a patient will call through a Facebook ad and they say, "Well, how does your office work? Or what can you guys do to help me?" And they're like, "Let me tell you what we're going to do for you." So the first thing we're going to do is we're going to do a free consultation. It's going to be about 10 minutes long. And then we'll have the doctor meet with you, and he's fantastic. He does a really good job, and he'll do an exam and take x-rays. And then we'll have you come back with your spouse on the next visit, because then we're going to go over your exam results and talk about how much care will cost, and how we can help you and how long it's going to take. And this is what I call I call it puking. So your staff, or you're just puking out all this information, and your patient has no idea or any context on how to take that information. And it ends up seeming like a really complicated or long or like arduous process to go through care, versus giving them sort of one bite at a time. And so all we're doing is we're showing one step at a time. Questions on this. So this part usually triggers quite a few questions. And Sam, you might want to weigh in here if you have any questions, but I wanted to see if anyone has any questions on this before we move on.
I think this is one of those things where, and Heather just posted a bunch of notes. I will say that we'll have all of these notes on one document that you can get after, and I'll tell you how to get it afterwards. But the pre-framing and just the preparation, it is so, that old saying, an ounce of prevention is worth $1, or what is the thing? An ounce of prevention is worth $1,000 of cure, or whatever. I don't know what it is. But the idea is just a little bit of planning and preparation. It could absolutely change everything. You could go from converting 30% of your new patients to 70, 80%. You literally could do that by just doing some of these things. And here, a couple of the psychological reasons why is just providing a greater level of clarity and comfort. If people don't know what's happening next, if they don't have a great level of familiarity with you and the way you do things, that's going to cause confusion and maybe unease. So this will completely combat those things and make it so you're always ahead of them. You're always you've got them by the hand, and they love to follow a confident person on their way to solving the problem, right? And I think just if you were to take anything from this, up until where we're at right now, it's just saying, always be one step ahead. Don't go 2 steps ahead, be 1 step ahead, okay? And so these are great tactical things that you can do. Scripting, we talked about that. We talked about that last week. And we have the updated daily marketers script for download in the patient stream users group. We talked about scripting. Even things like this should be scripted. So I don't know. I don't see any questions coming in. Maybe we ought to, unless you guys have any questions, anything you want to add?
Yeah, Sam. Thank you for that, Sam. And I want to add one thing. Yes, you're 100% right. All of these things were scripted in our office. And then, so Doc, if you're listening to this and you're wondering, like, okay, what kind of stuff could I train my staff on? This specifically, you should be training on a weekly basis. It doesn't have to be like, just train on, if this seem overwhelming to you, just train on one transition. So how do we take a patient from the front desk to a consultation room in the most Ritz-Carlton way that we possibly could? Make your own script for it and on what you want that to sound like. But this is stuff that we would train on over and over and over again. And it got to a point, here's the cool part. It got to a point where we were so well scripted, it became really fun, and it became kind of like a game. And so we would get, those patients that come in your office and like, oh, this person's going to be a pain in the ass. Right? They're grumpy, and they have all these I don't know if you can help me or not. How much is going to, you have these really difficult patients. When we have a difficult patient we knew was going to be tough, we would celebrate in our pre-shift huddle. All right, we got a tough one coming in. Let's see how well our system works today on Fred, right? And so when we could take a grumpy pants and turn him into a raving fan. That was I found that the most rewarding thing. And oftentimes those difficult patients, when you're pre-framing and using good communication and good customer service, it is awesome when you take someone like that into somebody who will just tell the world about how great your practice is.
Yeah.
And that's when you're really you really have it dialed in.
Yeah. Well, wonderful. So looks like I'm looking at the next slide, And we forgot to put in a slide here because we're transitioning away from pre-framing into the 3 things that clinics need to be doing right now. So we're going to, we didn't get any questions, so we're going to go ahead and transition into the top 3 things that clinics need to be doing right now in their clinics to, well, obviously in their clinics, to win, to get more new patients and, you know, keep people coming. So I'll go ahead and transition now.
Awesome. Do you want, Sam, do you want to talk about this slide?
Yeah, sure. So niche offers. This, when we talk about 3 macro big ideas that can change the direction and what you're doing on, you know, what you're doing in your practice, one of the ways that businesses get new users is by making offers. Now, in our case, in the chronic pain and acute pain space, we need to be speaking specifically to people. So I'll start out about what most people do wrong is when you're running advertising or anything else, and you're talking about how great your clinic is, how great a therapy is, how great this, that, or the other thing that you have going on in your clinic is, all the things that you're able to do. That is the absolute wrong approach to take if you want to get the right people in and get them in predictably. Okay, because at the end of the day, we've got several examples here. If you wanted to get a bunch of, you know, correcting bulge or spinal decompression patients, how would you do that? Would you do that by telling them how great and amazing your spinal correction programs are? You might get a few people that way. But if you want to get a lot of people, the whole idea is to put things in front of them that's going to make them immediately stop, grab their attention, and get them to read and get them to see what you're doing. Now, the enemy to niche offers is thinking that you are, you know, thinking that a commodity offer is a niche offer. So here's what I mean. There's certain things that if, for example, chiropractic offers, it's hard to create an offer that is niche enough for just chiropractic by having them to pay up front. Okay. They already kind of know what chiropractic is. Okay. They have an idea. Many people do. And so there's certain offers that we need to be more creative on. We need to like dive down a little deeper. Now, when you're looking here, the number one job of an offer is to get the right person to raise their hand. All right. So that bottom left-hand end neuropathy, and there's a picture of, you know, a person's thermographic image of their feet. Is somebody that is looking to lose weight or, you know, a normal, maybe even joint pain, are they going to take any action or is that ad going to grab any attention? No, it's not. So that ad did its job. The job is to get the right person to take and raise their hand. Lasting knee pain relief. Who's going to raise their hand to that? People with knee pain. Bulging disc, same thing. Slim down, liquefy your fat cells, right? We have, you know, endless approaches to doing this and just making sure that the first point of your marketing talks to a specific person and it goes problem, discovery, solution. Okay, so niche offers. If you are in the middle of Corona and you're wondering, hey, how can I get more new people? How can I get, you know, enroll more new patients? One of the things you have to be focusing on right now more than ever before is niche offers, condition-specific marketing. So it's a really big piece that once people get it, it really starts to you know, make a big push and a big impact in their practice. All right, this one's you, buddy.
Yeah. So thanks for setting that up. So regularly scheduled training. This is one that I think doctors feel like, ooh, that's a really good idea. I should do that, but never actually get it done. And there's a lot of reasons to regularly train your staff, but you want to make sure that, you know, I don't like micromanaging. I don't like looking over. I refuse to do it. And I will, most cases I leave, I trust my staff a lot to do it the right way. But it's hard to do that if they don't know what you want out of them. So what we did in our practice for a long, long time is, and we still do, is train your staff twice a week. And so we set aside every Tuesday and Thursday at noon, at lunchtime, we have lunch and we train. And we have a rolling list of topics, about a dozen things that we train on, and we make it fun. So we have lunch, we sit down, and we just do role playing. And so and they always know what's going to happen in advance. So pre-framing again, tell them, okay, this Tuesday on the schedule, we're going to be training on phone scripts. So everyone make sure that you know your phone script for Tuesday, and then we'll go through how to handle scheduling a new patient over the phone. And what you'll see will happen over time is that it becomes very routine for your staff. They're saying exactly what you want them to say. They're handling objections exactly the way they're scripted. And there's a lot of congruency with your team, and they're doing what you expect them to do. And it also, for your staff, it makes them feel, they know that they're doing their job the right way because you've told them that's how you want them to do it. And I've noticed a lot of friction over the years happen with clinic owners and staff when the doctor just assumes that they're going to do it properly. And then when it doesn't go the way the doctor wants it to, they get mad at their staff. And you can't get mad at your staff if you haven't told them the way you want them to do it. And so when you have those training, regularly scheduled training, it creates a lot of transparency, and it creates a lot of, there's a communication that happens there that, okay, you've got that script handled. You did a great job on the training. Great job. Let's train on it again in 2 weeks. And then before you know it, you have this like ninja trained staff doing things exactly the way you want it done. And it becomes very consistent. So now when you're objectively looking at your business and you're looking at your stats, you can look at your day one, your phone conversion stats. You can look at your, how many people are showing up for day one? How many people are showing up for day two? Really simple statistics. You can look at your stats and know, okay, something's off with our phone script, or something's off with your day one. So for example, 3 months ago, we had an 80% conversion on our phone script, but now we only have a 60% conversion. I wonder if there's something going on with the way that we're using our phone script. And sure enough, you'll find that, people have maybe deviated, or they're using their own script, or they're not sure how to answer a certain question, and it will affect your stats. So make some little keys here to staff training. Make it fun. We always paid our staff. So if you have hourly staff, pay them for their training. Bring in lunch from time to time. Make a game out of it. Give awards if you want to. Give some little like Starbucks gift cards or something. But just make sure that your staff is scripted and they're doing it the way that you want it done. All right. So last thing here, last subject we're going to talk about, and Rosemary, I see that you put a question up in the chat box. It's a good question. I'm gonna answer that in just a second. Let me get through this next slide. So if you want to know how to massively increase your new patient enrollments and conversions, here you go. This is a huge tip. So make sure to write this down. Don't give away too much information. And I hinted on, I talked about this a little bit earlier about what I call vomiting or puking information. So if you give away too much information, especially after an exam or over the phone, you will notice, and I've measured this time and time again, that your stats will start to sink. I don't know if this is the best example, but I used to be in sales. I used to sell medical equipment in hospitals to doctors. And part of the sales process was we would want to get as much information about what the doctor's needs are, what their concerns are. Like, so for example, if they wanted to buy this particular piece of equipment, we would want to know exactly what they wanted so that in our sales pitch, we could sell them on exactly what they were looking for. So if they wanted a machine that was easy to use and lightweight and was easy to clean, my sales pitch would be, here's this piece of equipment. This thing is really easy to use, it's lightweight, and it's easy to clean. So when doctors would, we had this saying, that's where I got the saying in our sales process was, oh man, the doctor just puked on me. Meaning they gave me all the information I wanted to know on how to sell that doctor on our particular product. The antithesis of that would be a doctor who would be like, man, I'm not really sure what I'm looking for. Just show me what you got, kid. And I'd have to try to do a sales presentation not knowing what the doctor was actually looking for. So in that scenario, we were, as salespeople, we were looking for as much information as we possibly could so we can make our strategy based around that. Now, what happens in clinics is that if you're giving away all your information at once, your patient will make a decision on whether or not they want to follow through with care based on whatever information they have in front of them at the time. So again, if you're saying, all right, the example I already used was the way our process works is we have a 2-day process, and we're going to do an exam on the first day. And the second day, we'll have you come back with your spouse. It's going to take about an hour. We'll talk about, like, it paints a really complicated picture of all these different steps that the patient has to walk through. And so it becomes confusing. It seems like a lot of work for the patient, and they end up not coming in. So this is why we're only giving away one step at a time to make it seem like the process is a lot easier. Another example here is, if you ever heard of like the miracle, the 9-minute miracle ab cure, and the joke in marketing is like the guy who wins is the person who comes up with the 8-minute miracle ab cure, or then the 7-minute miracle ab cure. Like, everyone wants an easy out. So if you're saying to a patient, hey, we can help you in as little as 36 months. And then over here, you have another doctor saying, hey, this process is it's a one visit process. Come in and we'll see how we can help you. And it just takes one visit. Most people psychologically will lean toward the one visit office, because why would they do something for 36 months when they get the same result in one visit or one day? Now, I know that's kind of a ridiculous type example, but when you're giving away your whole day 1, day 2 report of findings and treatment process all at once, they have no frame of reference for what their problem is, why you're recommending certain visits over a certain amount of time, why it costs more money, and why their insurance doesn't cover it. You're giving all that information away way too early, and they don't have any context for how to process that information. So I say that to say, let your sales process do its job. Don't talk about day 2 if you haven't done day 1 yet. Don't talk about how long the treatment therapy is going to last if you haven't done day 2 yet. So lead them through the process, let the sales process do the work. And when the patient has the right information at the right time, they can make the right decision based on information and based on how well they were treated in your office. So I say that to say, again, like, don't puke on your patients. Don't give them too much information, even if they're asking for, let me give you an example. The patient says, hey, I have back pain. How long will it take to fix that problem? And your front desk staff says, well, normally it takes between about 3 to 4, maybe up to 6 months. But we do have some patients too that have been here for years because they just love us so much. Don't say that stuff. The answer would be, that's a great question. The first step for you would be to come in our office so we can take a look at you, have our doctors evaluate you, find out what's wrong, and find out if we can help you. From there, we can determine what the best course of action would be for you. When would be the best time for you to come in, mornings or afternoons? So that way you're not giving away way too much information, just saying, hey, you need to come in for your first exam and consultation. That's it. Don't tell them about day 2. Don't tell them about costs. Don't tell them about the length of your treatment plan. Just keep it really simple.
And I think one thing that you taught 2 weeks ago that was genius, and maybe it's just, repetition is, we all need repetition. You always talk about, if somebody asks a question like that, to chase it with a question, right?
Yep.
Can you give an example of that?
Yeah, absolutely. What we're doing here, and you'll notice, I think some of you on the call today were on the training last week and the week before. There's a lot of crossover between what we're training on. So really, this is really important information and hopefully valuable. I hope you guys are finding it valuable, but there are some little strategies and tips and nuances that will kind of weave into these trainings, so that over time, in these little hour calls, that we only have so much time that we can talk about these processes, but over time, you can start to sort of spoon feed these into your practice in little bite-sized chunks, so that over the course of months and years, you can look back and notice that you've had this has had an impact, a big impact on your clinic. So if nothing else, I just encourage you to take notes and be on these trainings as much as you can, because I'm telling you, like, what I'm teaching you right now is one of the biggest differences between an office that struggles and an office that does really well and thrives.
Right.
And I've worked with so many doctors and so many clients and clinics over the years. Like, this stuff, as simple as it may seem, and you may be thinking, this is just common knowledge. And it probably is to a large extent. But if you're not applying that common knowledge to your practice in a meaningful way, and so your staff understands it as well, it's just going to be noise.
I love it. I want to ask a question real quick before you answer, and maybe take 1 minute to read Rosemary's question there. It's a good question. Has this been valuable so far, you guys? I mean, Dr. Wells has come on and he's extremely transparent. Not only is he giving you the lessons, but he's also throwing in scripting that you can start implementing right now. And hopefully you're taking notes. Has this been valuable? Let me know in the chat. I know a lot of people actually listen to this during, while they're doing different things and, all that kind of stuff. But hopefully, let me know in the chat. Grab that to the very bottom of your window. Hopefully this has been, yes, I'm an ortho surgeon and taking notes. Very nice. Orthopedic surgeon. Awesome to have you. Yeah, we'd love to. That's great. Rosemary says yes. That is awesome. It is absolutely phenomenal, the transitions that I've personally seen happen. I used to coach in clinics just like Dr. Wells. And Dr. Wells coaches currently. I used to do that back in the day, and nothing. I mean, the silver bullet or the magic wand, if you want to call it, are these shifts. Okay, who basically going in with a plan or going in without a plan. We all take it for granted the things that we're able to do. Dr. and hopefully I say this right, Dr. Ismail. Hopefully I said that right. Sometimes we take that for granted that we can go in there and, perform a surgery or, reverse type 2 diabetes or whatever it is. Those skills are so valuable, and it's not easy to get those skills, but these soft skills that really build our business, they consistently are overlooked and not really given the attention and practice that they need. If you do a little bit of what we've gone through in the last 2 weeks and today, it will absolutely change how you get new patients and how you convert them. And maybe after you answer the question, Dr. Wells, we can go into what you're planning on doing as far as next week's new patient training.
Yeah, and Dr. and Rosemary, I'm going to answer your question in just a second. Dr. Ishmael, your comments, thank you for those, are fantastic. Sadly, I 3 years ago, I saw an orthopedic spine surgeon for a broken neck, and I had to go through an ACDF surgery. And so what my experience with the orthopedic surgeon, so before I saw the surgeon, I had a consultation with the PA, and she, her communication was just awful. Sorry, my Siri's popping on. The communication she had with me before I saw the surgeon was so bad. She gave me, first of all, the wrong diagnosis, which is you can't really train on that, but also gave me like the worst case scenario. So when the doctor walked in, I was almost in tears because the PA is like, yeah, you're going to have your entire cervical spine fused, and it's really going to have an impact on you long term. When the surgeon actually came in, he's like, yeah, we're just going to fuse one level, not your whole neck, and you're going to do really well long term. And so the miscommunication there was so poor. And I don't know what, if they had any communication before then, or it was just the PA was taking the liberty of answering, answering my questions is based on her interpretation. But there are a lot of ways that you can implement this into a hospital type setting, and making sure that you're sitting down with your front desk staff and sitting down with your mid-level providers to make sure that you can even script a lot of these conversations to make sure that your patients know what to expect, and to make them, they should be telling your patients about what you're good at and what your skills are, maybe what you're not good at. In fact, the surgeon that I ended up using didn't have the best bedside manner, but he was really skilled in what he was doing. And so I was comfortable with that. And they said, hey, this guy's not much of a talker, but he's really good at what he does. And so I'm like, yeah, that's exactly who I want. I don't need to have a conversation with him. I just want him to fix my problem. And that was the surgeon I ended up going with. Are we still on, Sam?
Yeah, we are. I just stopped sharing the screen.
Oh, yeah. Okay. And then Rosemary, to answer your question, and thank you so much for your patience. So if I'm understanding this properly, it looks like you are you're scheduling your day one and report of findings in advance. And if I'm understanding that correctly, the one advice I would give you is I wouldn't schedule the report of findings in advance, simply because you don't have. You very well may schedule 100% of your patients for a report of findings, but your patients don't know that. And so if you're saying, hey, this is going to be at least a 2-visit process, that can seem overwhelming to some patients. So what I would do is I would just schedule the day one first and wait until you're done with your exam to schedule day two, because it's going to be more congruent in your patient's expectations. And so, and then you also have some rationale and some reason to schedule day two. So in other words, like a patient could say, hey, if doing it the way you're doing it, if it were me, I would say, well, why can't we just do both visits in one visit on the first visit? And so then you have to explain the reason for that. And you don't want to do that. So instead, if you wait to schedule day two after your day one visit, because then you can say, listen, we've done the exam based on your x-rays and exams. I think we can help you. I need to spend a little bit more time looking at your exam results, but let's do this. Let's set up a time to meet for the next visit, where I'll teach you how to read your x-rays. I'll go over your recommendations. I'll show you exactly what we can do to help you. And we can do that. It's going to take about an hour on the next visit. So make sure to, schedule that. We'll schedule that so you have time to do that, and so on. I think I saw your comment that helped. Yes. Okay, cool. Awesome question, Rosemary.
Well, we've had an awesome group of folks today. And, I don't know all of your names because we've got some of our users here, which we love having our users here. And then we've got some new folks here. Again, we would invite you to the future trainings as well, which I'll ask Dr. Wells about here in just one second. But if you are a user, then hopefully this will help you take all of these leads and all of the new patients that you're getting from PatientStream and get even better results. Cheyenne, I see you there. Dennis, Jamie, Max, and all you guys that we've got a lot of users that I don't know all their names, so sorry. But thanks for coming. And if you want to learn more about the marketing side of what PatientStream does, just shoot me an email, sam@mypatientstream.com. I put my email in the chat. Dr. Wells, what are we going to do next week on? I think probably next week, if I'm getting this right, next week will probably be the training that everybody, always asks about, that they want to know about. What are we training about next week?
Yeah, you asked me that question and I forgot to answer it. So next week, we'll talk about how to transition from day one to day two, because that's a really big drop-off point for a lot of patients and patient conversions. Then we'll talk about some strategies on how to set up a successful day two or report of findings visit.
Yeah, I think, day two and at the end of the day, committing new patients, for some people comes easy and for some people comes naturally. But there are definitely some things like what we've talked about today that are systems that you can plug in and implement and really change, just change the new patient thing. Again, if you go back to slide one, we are all about these trainings as well as, our company. What we're doing is focusing on new patients. We are all about new patient acquisition. And so, Dr. Wells, awesome stuff today. And there will be a recording of this as well as notes. I would say that, join us in our group. Find us on Facebook or PatientStream users group. I share a lot of cool stuff in there. Dr. Wells is in there. And join us in there. But yes, there will be a recording. Thank you guys so much for coming. And this has been a lot of fun. Dr. Wells, as always, you are on fire, my friend, on fire.
Thanks, Sam, for having me on. And I hope you guys have a great Thanksgiving and a great weekend. And thanks for being on. I hope you found this valuable.
Thanks, guys. Talk to you later.